Hi everybody, Ziv Simon here. I'm the creator of Surgical Master, the surgical training for dentists. Welcome to part 2 of a video called Tips on Extraction. And if you didn't watch part 1, go back and watch it so you have a little bit of the background where I discuss the money tooth and some of the extraction enemies and talk about a case sent to me by Dr. Jeff Rosenberg from Philadelphia. Thanks again, Jeff, for sending me all these beautiful cases. You're doing an awesome job. So if you didn't watch part 1, go back and watch it. It'll give you some background on how to identify challenges from one periapical radiograph. There's so much information that you can learn from one radiograph that can help you predict problems and prepare for them ahead of time and make your life much easier and with less stress. So here goes case number 2. So another money tooth, lower first molar. Jeff sent me a radiograph showing got a puncture point, basically tracing a fistula, and we're suspecting this tooth has a root fracture and the prognosis is hopeless. So the plan is to extract this tooth and replace it with an implant. The question again is, what are the extraction enemies? What are the challenges that you are seeing prior to extracting this tooth? And I'd like you to look only at one radiograph and get the maximum information from it. And I promise you that you will be much more prepared for the procedure and you'll become better and faster. So I'm going to give you like 3 seconds to look at this radiograph and just think about a few extraction enemies, some challenges that you're seeing with extracting this tooth. Okay, let's go. In real life, I'd like you to spend as much time as needed to look at all the details. So let's see the extraction enemies relating to this tooth. So number one, again, we're seeing that this tooth is endodontically treated. And I mentioned before that the root structure is going to be much more fragile and prone to fracture in specific locations along the root. And you would like to identify these spots where these roots might break. Challenge number 2 has to do with the existing restoration, a full coverage crown, and the remaining tooth structure. And I divide it into 2 parts, the crown part and the root part. Since this tooth has a full coverage crown, it may come off or you may decide to remove it strategically. And the root structure is also compromised on the mesial root where you have a pre-existing fracture. So you know this is going to separate. And the resorption of the apex of the distal root actually doesn't have too much impact on the extraction, but it's good to identify it. Extraction enemy number 3 is the shape of the roots. And it's important to identify the curvature. Obviously, the mesial root is much more curved than the distal root, much straighter. And that will help you decide where to place your instrument and the direction and magnitude of force that you'll use to remove those roots. Like I mentioned in the previous video, don't just look at the tooth you're about to extract. Look at the adjacent teeth, see if they're restored, see if there are any weak spots, because applying pressure on a tooth does apply pressure on adjacent teeth. And sometimes it's destructive, and if there are any types of restorations, in this case it looks like there is a class 2 composite or some type of porcelain, that can potentially break and put you in a very bad spot. So simply identifying a relative risk of causing damage to the adjacent restoration will make you more cautious and very careful to prevent this problem. Another challenge is that there's poor tissue. Now, how do I see the tissue on the radiograph? I don't. But I see it got a puncture marker tracing a fistula leading to the fractured mesial root. So I know that by definition, the tissue either on the buccal or the lingual is perforated. And as such, it's much more fragile when you reflect a flap. Your flap may tear. So I'd like you to pay attention to that. The soft tissue is very, very important, obviously. Last but not least is the periapical pathology. And you see that there is a radiolucent area around the apex of the mesial and the distal root. Both are potentially communicating. Now, when you extract the tooth, you'll have access to the lesion, be able to debride it with some spoon curettes. Sometimes the challenge is that the lesions embed themselves in bone underneath the furcation bone in an undercut, and it's kind of hard to reach. So we have to use all sorts of small little spoon curettes, sometimes even conventional curette or Pritchard curette to get into those undercuts. And that takes time. Sometimes you need to spend a lot of time just cleaning out the infection. And you're doing it very carefully so you don't jeopardize the interseptal bone, which is the future implant location. So this is a relative challenge. So for this tooth, there are a few extraction enemies that if you identify them ahead of time, and again, you see how much information I get from one periapical radiograph. If you identify them ahead of time, you'll notice that you're so much more prepared. You know how much time to allocate for the procedure. And you have less stress because you can pretty much know how this procedure is going to go, and you'll see that you'll become so much better and faster, and the extraction process will be much more predictable in your hands. Once you identified all the challenges, the next step is to create an extraction strategy that will take all these challenges into account and allow you to create a step-by-step protocol on how to extract this tooth successfully with least complications and stress and trouble, and hopefully faster. So I hope this video was very valuable to you and helpful to you in planning lower molar extractions and identifying some of the challenges or the extraction enemies. What I would love you to do next is leave me a comment below. Let me know, what are your challenges, what are your problems when you're extracting lower molars? How would you extract this tooth? What would be your strategy? What would you recommend doing? I would love to hear from you. Leave me a comment. Feel free to share this video. You can also check out the book on how to extract the money tooth and create a great implant site to learn about my own journey and how I came up with these protocols and the extraction enemies and many, many practical tips. But more than anything, I describe a thought process, a philosophy of extracting lower molars. I know this is going to be very valuable to you.